Welcome back, ladies and gentlemen. It's now time for yet another very, very interesting topic, and which is advances in 3D printed orthopedic implants to save limbs. Well, let me go ahead and now introduce our speaker who's going to join us is Celine Parekh, who's MD, also known as the Fantasy Doctor. Well, is an orthopedic surgeon and foremost expert on sports injuries who's fast becoming the go-to expert for the multi-billion-dollar fantasy sports industry. Ladies and gentlemen, please join me in welcoming Sleed Farek. A warm welcome to you, sir.
Thank you so much, Dhwani, and thank you for Ty for organizing this and asking me to be here, especially my local chapter. Um, we're going to not talk about fantasy sports, although it sounds really intriguing, and that's a whole nother topic in and of itself. What I'm really going to talk about is using 3D printing, which has transformed so many industries, but how it's allowing us as orthopedic surgeons to be able to save people's lower extremities and their limbs. Now, if you think about 3D printing, it's basically the deposition or depositing plastics, metals, ceramics, different materials in a layered fashion so that you can get manufactured complex goods in very simple fashions. Now, there's some real advantages to this. You can get increased intricacies and complexities of products made, and you can reduce inventory and eliminate assembly steps. So you can make something like this, which is very complicated, which you could never make in standard operating techniques. When you look at how 3D printing has transformed the world already, we know it's already in consumer goods, from shoes to orthotics to prosthetics. And in the field of medicine, it's already changing the way we do things. So the initial applications of 3D printing were in anatomic models, trying to allow surgeons to understand very complicated, unique surgeries that needed to be done. And you could practice this out of the operating room so that when you brought the patients into the operating room, you had already had a chance to practice this. In the US, there is expectation for tissue and organ fabrication such that a lot of our soldiers are getting CT scans now before they're even deployed, so that if there are injuries, there is a CT scan that can be used as a prototype to develop and fabricate their tissues and organs. In the pharmaceutical industry in the US, there are now drug doses that are 3D printed to allow for actual specific dosing of medications that need to be made. So for example, if you have hypertension, maybe you don't need 2.5 milligrams of a medication, which is available currently, or 10 milligrams, which is available currently. Maybe you need 3.25 milligrams. Now you can 3D print that. But from an orthopedic perspective, there's two areas that this has really changed what we do. One is custom instrumentation. So I'm not going to make this very esoteric from an orthopedic standpoint, but you're going to see some x-rays and it'll be very easy to understand what I'm telling you. So this is a patient who came in, had ankle arthritis, and these are x-rays of the ankle. The old way of doing some of these surgeries is we would attach devices to their limb and then replace their ankles as needed. We can now 3D print some of these devices, some of these cutting guides, and these two white ones are showing you some of the cutting guides that we can 3D print specific for these patients' anatomy. We can go into the joint, we can do the bone cuts as we need to, and we can replace that entire ankle joint with a 3D printed module. Now, the device itself is not 3D printed, just the cutting guides are to make our life easy. So you may wonder, well, why would you want to do that? Well, it saves operating room time, which we know helps with patient outcomes and decreases complications of anesthesia, but it also allows us to very quickly and simply be able to put these implants aligned in the place that we want them to optimize outcomes. Here's an x-ray of somebody who has a bunion where the big toe, if you see this left x-ray, the big toe is leaning towards the other toes. And we can make these cutting guides and 3D print special plates to be able to take these patients in the operating room, do the cuts with the cutting guides that we've planned for, be able to straighten the toes out, and be able to use our 3D printed implants to give them better outcomes, better alignment, and make these patients happy. Here's a patient with the left ankle x-ray. You can see the ankle is kind of tilted, the foot's tilted inwards. You can appreciate that even if you're not a physician on this x-ray. And we can 3D print the plate with this little wedge that you see in the middle of the bone here. Again, 3D printed, customized implants for this patient to be able to get the leg better aligned. So The customization of metal implants has really transformed what we can do, because we can allow these complex geometries that mimic normal anatomy to be built into these custom implants to allow for better outcomes. And there are ways that we can do this already that are not custom with some of these, what we call off-the-shelf implants, such as the ones shown here. And we can take people who have very, very flat feet that are problematic for them. We can put in these metal wedges that help to realign their foot. You can take them from being very, very flat, like you see on this left x-ray here, and you can realign the whole foot, give them an arch again, all through using these 3D printed non-custom implants. But it's really when we talk about custom implants that this becomes exciting for limb salvage or for saving people's legs from being amputated. And when we look at some of the implants that are out there, they've taken inspiration from nature. So one of these companies has incorporated a honeycomb anatomy into their metal implants to allow the bone to grow into the implant so that the metal becomes integrated with the bone. Another company has used the mechanical engineering techniques to do the truss type of implants into these metal custom implants. And then another company has done these wavy bodies, taking inspiration from the water waves to be able to incorporate bone healing. So our challenge as orthopedic surgeons is we see patients who have these big areas of bone that are lost, either from trauma or from infection, and they come in to see us wanting to have some solutions. And currently, before 3D printed custom implants were available, we were challenged by ways that we could offer them solutions. So I'm going to show you some cases here so it gives you some idea of what we're doing. This is a surgeon who's in my local area, has an infection in the middle of his foot, and that infection is eroding the bone. Now, as it erodes the bone, he starts losing function of the foot, and he's given 3 options by outside physicians: either an amputation, either going in and cleaning out the bone and then trying to take bone from somewhere else in his body and put it into this area, or just letting it be. So he comes in to see me, and you can see on some of these x-rays the bright white area. That is basically where we have cleaned out the infection and put in cement that has antibiotics in it to try to clear the infection. While we're trying to clear the infection, we get a CAT scan, a CT scan of his foot. We take CAD drawings through the software, and we are starting to plan a 3D printed cage that will allow us to replace his bone with this 3D printed implant. And so you can see here, there's a big area of space that was infected that we are trying to fill. And so here's one of these cages. We can put it into the bone to make sure it fits well into the foot. We take it out, we pack all that open area with a cadaver bone, with some protein that stimulates bone healing, and we put it back into the body. This is 3D printed, recreating his anatomy from his other side, allowing us to be able to lock the middle part of his foot together, which allows him to keep his foot, clear the infection, regain function. And the surgeon is back to an active lifestyle. Here's a patient who, when he was 12 years old, was playing with a shotgun, shot himself in the big toe. Now, he was 12 years old, so as he grew, his smaller toes continued to grow, his big toe stopped growing. And so you can see here on the left side, his big toe, that bone looks shortened, and it also is no longer in one piece, it's in 2 pieces. So we do something where it's a staged procedure where we take him to the operating room, we bring the length back to his big toe, and that's what you're seeing in stage 1, where we have these devices that shoot pins into the foot, bring that length back, and while we're bringing the length back slowly over time, we start planning a custom 3D printed cage, which will allow for bone to grow. And this is what the CADs look like. And so we take him to the operating room, take that device off, and put in the cage with bone again, and he's back living life, playing sports, and actually he's gone through college and has done very well. Here's a patient who had an ankle fracture, a break of the ankle. It did not do well. He ended up with surgery trying to lock the ankle up, done by an outside surgeon. It ends up getting infected. An infection from an orthopedic standpoint is really a big, big problem. And typically when it enters into the bone, you end up needing to go to the operating room and cutting the leg off. Well, he comes in to see me and says, "Hey, I really don't want this cut off. What can you do for me?" So using some of the experience we had from the cages, we can go in, clean out all that infected bone, again, put that antibiotic cement in there to try to clear the infection. And we created something called a Death Star. Looks like the Star Wars Death Star, but it's a spherical cage which will allow us to put a rod in it and be able to keep his limb, get the bones to heal together, which is called a fusion. And he now has his limb, is back to gainful employment, and has some quality of life back. Here's a 32-year-old male who was a smoker, had a break of his shin bone, and you look at this. I'm seeing him now 2 years after his break, and you see that you can see something abnormal in that shin bone. And this is how he comes in to see me. That leg is not straight. He's actually walking tilted, and the surgeon who treated him told him, hey, there's nothing more I can do. Go live your life. So he comes in to see me, and we start working him up. It turns out that he has an infection there. So we go in, clean that area out. We put, again, that device on there that shoots pins into the leg. We do step one. We clear the infection. We bring him back to the operating room. We now have an area of bone that is missing. So what we do is we use his other leg. We take the template of the missing bone from the other leg to recreate the cage that we need for the affected leg. We fill that cage with all that bone, like you've seen me do now multiple times. We put a rod into his shin bone. And again, another person who's back to quality of life, his leg is straight, running and jumping and doing all the things he wants. I'm going to skip through this case because I want to make sure I'm showing you some really pertinent cases. This is a 16-year-old athlete who comes in to see me. And if you look at this film, there's this bright spot in the ankle itself. It's an area where the bone is breaking down. The cartilage isn't breaking down in the joint, but the bone is breaking down. So this patient's first surgery involved us going in, cleaning out the broken down bone, and trying to put bone back in there to encourage new bone to grow. So she does okay for about a year after that surgery. But then after a year comes in to see me and starting to complain of more and more pain. She's not able to walk and is walking with a limp. So we get new images and we're seeing the breakdown of that bone in that ankle occurring more severely. It's getting bigger. And again, she's 16. This is a very difficult area to access from a surgical perspective. And it's basically patients who died, donated their tissues, they've been sterilized. We can replace it with cadaver bone. And over time, her body will grow into the cadaver bone. It'll all become her bone. But in a very complicated manner, we can do this very simply using 3D printed guides. So you can see here, we're accessing the ankle. That's on the left-hand side. On the right side, I've got my first guides that are down, and then I've got for. This is a soldier who got shot in the leg by one of his co-soldiers, went through his heel bone. He has an infection. The military was about to kick him out of the military because he had a persistent infection that he couldn't clear. He could barely walk. She comes in to see me. We go in, we clean out the infection. While we're waiting for the infection to clear, we 3D print a very complicated geometry which allows for bone to grow into this implant. And so we go in, take out that cement, that antibiotic cement, we prepare the area. Down on the lower left-hand side, you're seeing 3 different sizes of 3D printed implants that we created, complex geometry that we couldn't do with standard manufacturing, basically to replace that area of bone loss. And he's back being enlisted in the military, contributing to the safety of the world. So we started initially doing small parts of joints, but then it got more interesting. This is a girl who had cancer, was because of her cancer treatment, was put on steroids. The steroids caused her bone to die, and that's what I'm showing in this MRI on the upper left-hand side here. The bone of her ankle is dying. Now, in the past, our only options were to fuse her, which means to lock the whole thing up, or to cut her leg off. But what we can do with 3D printing is we can actually give her a brand new 3D printed metal bone. And so here's a CAD drawing and a cartoon of what we're planning. We go in, we're cutting out the entire bone. We've got some trials to see what size bone she needs. We've got multiple sizes of this 3D printed bone created on the left-hand side, and we can pop it into place. And you can see now she's got that metal bone. That's the black thing you're seeing here, which with great motion. And so she's able to maintain her lifestyle. And it's really amazing when a father calls you, and she ended up needing this on both sides, both ankles. A father calls you and he's crying to you. It's during the holiday season, and he says, Dr. Parekh, my daughter for the last 5 years has been homebound during the holidays, but you have given her a life back. She's back in the big malls, shopping with her friends, having little to no pain, but because of these 3D printed bones. And that's amazing. And so here's a patient who's had this done 3 months prior to this video. She's back to walking, and you can barely even tell that she's had the surgery. It's the right side, and she's actually doing box jumps in the gym. And so it's gotten more complicated for us. We're actually able to replace the 3D printed bones. We're actually able to do some ankle replacements. We're actually able to fuse bones, lock bones to the 3D printed bones as well. And all of this is kind of brand new novel technology, allowing us to save patients' limbs. And I want to end with this one really telling case. This is the motor vehicle, the car of a patient of mine who I saw. She's 19 years old, got into this accident. The car is totaled. On one side, she has a broken ankle, was seen in the emergency room. They're fixing that. The left-hand side, the bone popped out of her body, and she's basically living about 6-hour drive from me. Pops out of her body. She's seen in the hospital. They offer her an amputation, a cutting off of that left leg. She says no. The mom goes back to the accident site, finds the bone the next morning, brings it to the surgeons. They say, hey, it's too late. We can't save this. She needs her leg cut. Mom gets on social media, finds what we do here at our institution at Duke, says, hey, can you send this patient to Dr. Parekh? So they send her to me. Now I know you guys can't tell this, but I'm going to tell you on the inside of her ankle, she's missing one bone there. And in the heart of her ankle, she's missing a second bone. So she's missing parts of 2 bones. So we, using 3D printing, are able to replace with metal 2 bones. And you'll see this in this x-ray here, the center bone, as well as the inside of her shin bone. This is the first time this has ever been done in the history of the world. And this patient goes on, she's now 2 years out, has gone on and has basically saved her limb. She's 21 years old now, a young female who wants to be able to go out and date and have fun. And she's restored her quality of life and does not have to have an amputation. And so I'm going to end here with the interest of time and to be able to take questions. But I want to tell you that these patients are back to working on the fire force. I have patients who are playing 18 holes of golf 3 times a week. I have patients who are back playing what's called the senior games, which is almost like the Olympics of seniors. I've shown you the patient who's box jumping. And so it is pretty amazing what these patients can do. And so I'll open this to questions if anybody has any questions.
Dr. Celine Parekh, wow, man, I'm speechless. Such an honor to have you here with us today. Thank you so much. I believe, sir, we do not really have any questions from the audiences. And I want to once again thank you. And thank you for explaining such a complicated procedure in such a clear and precise way, where it's absolutely fantastic to see the advances in 3D printed orthopedic plans. And once again, I'd like to thank you, Dr. Celine Parekh, for joining us today. Thank you very, very much. Such a
Thanks so
pleasure
much.
and honor to have you with us. Thank you.